The most important station of your exam is how to prioritize your labor ward, and it is also known as a labor ward prioritization. So, most importantly, you should know that any life-threatening problem related to mother is your topmost priority in the labor ward. In the labor board station, you will be asked in the first step to read the labor board, and then in the next step to discuss how what to prioritize, why to prioritize, why, when to assign, and to whom to assign this particular station and how to manage. Please remember that while prioritizing the patient and talking about the management, you should always talk in groups. You should not have to focus on each and every minor details in the management. Just talk in the groups in the major bulk that I will resuscitate the patient. Do not say A, B, C for resuscitation. Just say resuscitate the patient in case of any life-threatening event so that you save your time and you will cover each and every aspect of your labor board station to gain the maximum marks. So in the labor board, first of all, you have to read the scenario very carefully, row wise. There will be the 5 to 10 stations or patients given in your labor board with including the name, age, risk factors, and current situation of the patient and examination findings. Whenever there any examination finding is missing and you need that examination findings for your further management in labor board, please remember that you have to ask the examiner that I need examination findings for to complete my management. It is up to on the examiners that whether she will give you or not, or she will just say this proceed with your further management. Otherwise, if any examination is missing, you will have to ask the examination. This will also add a one score for your exam. So to prioritize the labor board, how to prioritize it is very easy. First of all, any life-threatening complication to the mother is your topmost priority, and it should be given to the senior most faculty available that time. The examples include bleeding. It can be antepartum hemorrhage, postpartum hemorrhage, post-op bleeding, or post-op shock patient in the gynae. So it should be assigned to the senior most faculty, which includes the senior registrar and the fourth year resident. And the second most important life-threatening emergency is the drug reaction. Drug reaction is life-threatening because you have to manage the patient within the minutes, within seconds to minutes. So it should also be assigned to the senior most faculty. The second most priority, if present in the labor board, should be the eclampsia. It should be assigned to the fourth year or third year, and afterwards the fetal distress. It should be assigned to third year and second year. And always remember while managing the fetal distress, first of all, unless and until there is any acute emergency event which needs to expedite the delivery, always and always manage conservatively initially. Do the conservative management and then proceed towards the further management of fetal distress and expediting that delivery. And it should be assigned to the third year and second year, and it should be the third most priority. The second most priority should be any of the pregnancy or any patient that is laboring along with any comorbidities like OPS poly, PAH, GDM, twins, VBAC, breech, grand multi, and it should be assigned to the third year or second year. So while talking about the miscarriages, you should know that the miscarriage should be assigned according to the type. Whenever there is any incomplete miscarriage and the RPOCs are in the cervix, you should know that the patient can undergo vasovagal shock and it should be the topmost priority to manage that patient to incomplete miscarriage. However, the miscarriage, unless not bleeding, can be taken as the semi-urgent or routine priority. And so is the further cases of the miscarriage. And incomplete miscarriage is not a priority. There is also one station regarding episiotomy stage, and you can give it to the house officer and prioritize it as the semi-urgent case. Another patient or to ask about is any patient that has been admitted in the ward with the to control the basal levels and with the GDM, and her basal levels are highly rearranged, the pre-meal or post-meal, and it should be assigned to the house officer. Just manage the patient according that you need to calculate the divided dose of the insulin if needed, and ask the HO to give that dose of insulin. So this should be the your routine priority or the last priority. The missed miscarriage, if not bleeding, should also be stated in the ward and with the routine priority. Just put it on the other stage list, elective list. So, how to start your labor board and what to seek to gain the maximum mark and to pass. Just say that I am Dr. XYZ. I have gone through the instructions. I have taken the charge of labor room at 8 a.m. with my team, including senior registrar, PG4, PG3, PG2, PG1, house officer, or midwife or nurse, whatever the given. I should assign my tasks to my team as per the competencies and prioritize the patients according to. Now, there are the two levels on how to prioritize the patients. In the broad exams, they usually use the terminologies of top urgent, urgent, semi-urgent, and routine cases. However, in the Pakistan exam, we prioritize the patients according to the first, second, third, fourth, and fifth priority. Both are good, both are well, both can be done to pass your exam. And so I shall assign the task to my team as per competency and prioritize the patients according to one to first, second, third priority in order to ensure the healthy mother and baby outcome. For each patient, I will confirm the patient's identity, take brief history, and do focus examination. While doing the patient's identity, that comes in the patient safety. Whenever in the any exam station, there are the points of patient safety, and if God forbid you fail to follow the patient safety, you are unable to pass your exam. So patient's identity and patient safety always come first. Take the brief history. You can say that I will ask quickly go through any allergies, the risk factors present, the comorbids presence of the patient, and do the focus examination. My top priority must be, as I have already told, to the life-threatening image, the life-threatening patient or case, whatever that was, either the bleeding or drug reaction or eclampsia. Remember, if any life-threatening event like PPH, APH, and rejection is not present and eclampsia is present, so eclampsia must be your topmost priority. So just prioritize your labor board very wisely. So this is how you will have to start your labor board to gain to pass the exam easily, to have a good impression on your examiner, and then start prioritizing the labor board and manage the patient or that case row wise. Just say that my topmost priority is bleeding or APH or PPH. I will assign this to the senior registrar of fourth year, and I will manage this patient as since the patient is in shock or whatever the bleeding cause, whatever the thing is. I will resuscitate the patient, start the PPH care bundle, manage the PPH according to the medicines available, my instruments available according to the logistics, and this is stepwise approach. You should follow all the flow chart of the PPH that is present in the guidelines of the RCOG and other local guidelines. So now comes the WHO Labor Care Guide. You will be asked about the comparison of the WHO Labor Care Guide and the partogram and the good points which has been added now. Since it is a labor care guide and it also overcomes and completes with the second stage of labor as well. So you should know how to fill this labor care guide. A scenario can be given with the time and you will have to fill this labor care guide according to that given scenario, and the management can be asked from you according to that scenario. Just put the plot and the findings on this graph and then check in which station the head is lying or which station there is a vertex or with what is the dilatation, and manage the patient accordingly. So there can be a session on the X-rays regarding how to interpret the X-rays and the HSC reports and how to perform that procedure and can finding can be given and how to proceed with the management. Another one can be the ultrasound pictures of the PCOS patient, how to counsel them, and a picture of anomalous baby on how to counsel that anomalous baby. So the X-rays include lost IOCD and the how to manage the lost IOCD stations. And that's a very important station regarding the exam is the breastfeeding. The 10 steps by WHO. You should learn by heart all the 10 steps of the WHO. This is one of the exam station and the pet marks will be given to whole of the who have gone through the 10 steps. You can be asked regarding the different positions by giving the scenarios and what position and how to counsel the mother to breastfeeding and the clinicals related to that. The case-based scenarios including mastitis, abscess, cracked nipples, how to treat them, what positions to be used for the breastfeeding for these particular cases, and the 10 steps. So the breastfeeding is very important for the animal level. Hysteroscopy is in the domain of timing, so you should cover each and everything of the hysteroscopy, which are its type, identify different structures in the parts of the hysteroscopy, its indications, contraindications, complications, the mediums used for diagnostic versus therapeutic hysteroscopy, the type of anesthesia, the position used, and most importantly, RCG classification of hysteroscopic procedures, which are level 1, 2, and 3. So you should know about each and every details of the hysteroscopy for passing your exam. Last but not least, what you need to pass for the exam is the study material which you have already gone through while passing the IMM written exam. Practice, practice, and practice. The clinical exam, the practical exam is all about the practice. Please practice. Make your voice audible while practicing. Practice with your peers and the colleagues and be confident while performing your station. You know each and everything, just you need a confidence and a practice to pass your exam in the first exam, first attempt. So good luck and thank you.